especially for people that are just starting out with a company, and even for some of the more advanced people. Sometimes it's a little bit of a challenge to tell the new people coming in what products they need to use for what conditions, what they can combine, what they shouldn't do, what they should do. So I'm going to try and address a little bit of what I do in my practice, and just to let you know, this is not the only way. What I love about this product is its versatility. So we're going to go through a few different approaches to kind of give you guys some guidelines. Hopefully, it'll be a little bit more clear how to make the product even more effective than it already is. So just a little bit about me, how I got into the product. I'm not going to spend too much time on this because I really want to focus on the product. And okay, this is going to be like the same thing like at our other presentation. I'm trying to change the slides. And okay, there we go. Okay. So I back in '99, I was involved in a plane crash, and so that was just when I was starting chiropractic school. So I thought my career was going to be over before it even started, and so it took me almost a year and 5 months after the plane crash. This is kind of an indication of me here. I wasn't able to walk. My whole left side got paralyzed, and they wanted to do surgery. And this is kind of when I found out the power of chiropractic and other tools that helped me get back on my feet. And what I really want you to understand is my passion for this product is because of how effective it is. Because in my practice, because of my background and my health challenges, I am always looking for the best possible tools to help my patients get out of whatever issue they're having. And most of my patients have been to 5 or 6 other doctors, and they've all but lost hope. So when this product was introduced to me, I was very skeptical, as I always am, and I really didn't want anything to do with it, to be honest with it, because it takes me a lot of time to do the research and really understand if I'm going to be using this with my patients or not. I first have to test it on myself, then on my family, and then only then do I give it to my patients. But luckily for me, I guess there was some kind of divine intervention, because I had 4 patients in 1 week, different patients, who brought me this product in 1 week. So I kind of said, okay, I hear you. So I started my journey with this product. So my approach in my practice is help the mind and body do what it's designed to do. And what is the body designed to do? Designed to repair itself, designed to heal itself. It knows how to do that. I can tell you that when I was coming out of school and I was treating patients, there would be certain patients that I could help and other patients that would not respond to my treatment and my therapy. And I always wanted to know why. So I'd go out and learn a new technique, find a new nutritional product, and on and on and on it went, right? And then at one point, with more challenges in my practice and more health challenges, I kind of understood that, we really take it for granted of what the body's capable of. And because of certain models that we're used to as we're growing up, we are taught in a certain way that the body, is this machine that, if something is low, we just fill it up. If something is high, we just kind of decrease it. And it's this kind of, primitive machine that needs help. And that is the furthest thing away from the truth. So I was able to kind of do a paradigm shift of how the body worked. And then I started to see miracles because I started to support the body. And this is what this is all about. I want you to understand that this product doesn't treat disease. What this product does is it optimizes the body's ability to treat itself, to repair itself. And it does that in an amazing way, because I've never seen other supplements do what this product does, because of how effectively the body utilizes it, right? So the vital nutrients needed by the body can be replenished, but if they're not replenished quickly enough and they are used up, that is when we start to get problems, right? I always ask my patients, right? We know the body can heal, so why do we get sick, right? And the reason we get sick is because the stresses that are coming into our body are so much at this point in the environment we live in that it's just not able to keep up. And this is why this product is so effective, because it can go and bypass all the systems that are out of balance, go right into the bloodstream, go right into the cell, get recognized by the cell, get taken up by the cell, and then those repair mechanisms inside the cell can then start to do the work of repair, right? There's no magic here. We just have to understand the science, right? So again, just to understand, we are under a burden, a toxic load of stress, emotions, and other things that are going on around us like never before. And this is why there's so much health problems and health issues that we are encountering. And as I always say, when I first started practice 22 years ago, I could get a patient better with 1 or 2 regular supplements that they would take by mouth. And then fast forward 10 years, I needed 5 or 6, and then more, and then more. And each time it's becoming more and more challenging to treat somebody. So this is the next generation. This is kind of the next technology that arrived that we need right now in order to deal with the toxic load, not just toxic load chemically, but emotionally as well. So this is a really interesting thing. I mentioned this in other presentations, that back in 1995, they did a study, and the study that was done in Germany, and they wanted to see how many toxins we find per cell in the population. It was about 1,200 people, and they determined that there was about 10 toxins per cell back in 1995. The study was repeated in 2005, and that amount of toxins grew to 500 per cell. So I don't even know what it is right now with all the invisible stuff that we're exposed to. So this technology that we are all so lucky to have, it couldn't have come at a better time. We just have to get a little bit better at using it so we can see even better results, right? We have to fix the cell to get you well, right? We kind of forget that everything has to go into the cell. This is cellular nutrition. This is different than just taking other supplements because of the way that it gets utilized by the body, right? So I'm not going to go into the whole process of how the company extracts everything. We just have to understand that the body recognizes food. What this company's been able to do with this product, they've been able to take the food's herbs and fruits and put them into therapeutic dosages, into these lozenges, into these rapid DNA drops that our body can utilize in order to replenish itself at a cellular level so it can do the job that it's designed to do, which is repair and heal us, right? Again, we all know about negative, positive ions. I'm not going to get into all of that. I just really want to spend some time going through the different combinations of things that I use. So here is all of the products that we have available to us. What I love about this is, even though for you it might be a little overwhelming, there's not that many products in the line, and the versatility of these products when combined is truly amazing, right? So I'm going to go through a couple of different combinations and then give you guys a couple of different ways that I use the product in my practice. So the first thing that I want to do is I want to go through some guidelines of how we should combine products and what we should expect. So I always tell my patients, if you have a simple condition like, you cut yourself, you banged your knee, whatever, then you're okay with one product, right? You can use one product for acute things that just kind of happened right now, right? So for example, I love Stop and Slide, right? We're all very familiar with these products. If you do anything musculoskeletal related, you can use Stop and Slide. Stop is great for anything to do with pain, with headaches. Anything anti-inflammatory will be involving this specific product, Stop, right? Stop is combined with Slide. Slide is really good for replenishing collagen and anything to do with joints, right? So when we combine them together, they're really good at taking care of pain, right? So these two are used for pain, right? We then add in Relax, and again, you're going to see some of the combinations. We then add in Relax because Relax, basically what it does is it replenishes the adrenals. The adrenals are basically your batteries. They turn on whenever there's any kind of stress. And if the batteries are drained, your body's not going to have the capacity to repair you as well as it does. So when we use Relax, we use it in many different kinds of programs, right? So here we go, back to this slide. Protocols for anything chronic need to be done for 3 months to really see, is this helping? Is this not? Now, that doesn't mean you're going to see any results at all. You should start to notice certain things shifting, but don't just look at the pain shifting. You might start noticing they're getting more energy, that you're sleeping better, right? You start paying attention to how the body starts to repair and heal itself, because the body doesn't just go after the symptom. I tell this to my patients every single time. When the body repairs and heals itself, you're going to start to notice things happening in the body. Because if somebody comes into me with elbow pain, right, and they have diabetes, and they have autoimmune disease, and they have all these other things, they're like, can you fix my elbow? That's maybe not the body's priority where to go, right? So when we start using the product, like, I use the product for a week and I don't see any results, right? And it's very frustrating. But when we understand how to use the tool, then we can kind of fine tune things so then that you're able to get the results that you're looking for, right? Remember, we're trying to fill up the reserves inside the cell. When those reserves are going to be filled up, then the body can do its work. And it's going to, at its discretion, tell the body, the body is going to, at its discretion, tell where these resources are going to be delivered to. It might not be the elbow, it might be something else, but as that something gets better, so will the actual symptom that you're there to actually work with, right? So remember, we're trying to fill up the cellular reserves. As that happens, the body starts to repair. Start slow and layer in products based on how you feel. I can't begin to tell you that more is better mentality doesn't necessarily work here. I'll give you an example. Had a patient who is a 40-year-old male, right? Prone to anxiety, prone to all kinds of different nervous system conditions. All he needs to do is take a quarter relax under his tongue and he's good. And that's all he needs. If he takes more, he doesn't feel good. I have a 6-year-old who is obviously having some attention deficit stuff. He's having some issues with learning. And he went out with his family for dinner. And basically, the mom just came and told me in tears, the kid just took all the food and threw everything on the floor and took water and spilled everything on everybody, right? He was given 2 relaxes, not a half, 2. He's a 6-year-old. And that calmed him down. So everybody is different. So that's why you need to see how your system works. That's why I tell people, start slow and layer in products based on how you feel. Every 3 to 5 days is just a guideline. It's a starting point. For me, for example, I'm very sensitive to things. So sometimes it takes me a week, sometimes longer, for my product to start to go, basically for me to start with one product, finish it, and then go to the next product. Everybody's different. These are just some guidelines. The next thing is understanding the difference between therapeutic and prophylactic doses, right? If you're taking the wrong dose of something, it will not work for you. And then you'll say, oh, this product doesn't work, right? So what you want to understand is prophylactic is 1 to 2 drops and therapeutic is 4 to 6. Have I given more to people? Yes, I have. Have I given less to people and it worked, like with a half? Absolutely. But that's the thing, because this is a very individual kind of thing, you just have to give it time. That's why I say, try something over the course of 3 months and then really understand. If after a month you're absolutely not noticing anything, then you need to change course. You need to ask for help. You need to ask somebody who knows a little bit better in your upline, possibly, to help you out to understand how to better use the product for the condition that you have. So, let me go back to that. When creating a protocol, right, use therapeutic doses, because I can't, again, begin to tell how many people more is better. So they'll start taking like PFT. That's an example. Okay, so if I take like 10 PFTs, my weight is going to go down more quickly. I can't begin to tell you how many people messed themselves up doing that, and they got all these side effects that they were not looking to get, right? Anything in the right dose is good. Even broccoli, if eaten too much of, you're going to get some kind of a side effect. We just have to understand that more is not better. It's got to be the right kind of doses. So the way we start to put combinations together is understanding what system has the main issue, right? So for example, for my mother-in-law, she has autoimmune disease, right? So we have to understand that she's got her immune system involved and she's in a lot of pain. So for her, what we did is we chose therapeutic dosages for those two systems. For example, we gave her grow and we gave her stop and slide at therapeutic dosages. And for everything else that we needed to support her with, we went in prophylactic dosages. Again, these are just guidelines, right? You don't want to be taking 20 or 30 candies a day and not understanding what the heck is going on and then getting undesired symptoms and side effects, right? So I hope you understand my kind of thinking when I do a protocol for somebody, okay? So let's keep going. Okay, so here's the difference, right? So here we have simple program versus a comprehensive program, right? Simple program, what does that mean? It means that we're going to take just like one thing. We can just take relax or we can just take stop for something that is going on and it's acute and it will work for it. But for something that it's more complicated and for something that has a more chronic character to it, we need to build out a comprehensive program, right? So in this case, what we're talking about is allergies. Can we use ALT for allergies on its own? Absolutely, we can. But a lot of times, because there's other things involved, there's digestion involved, there could be parasites involved. You may be just way too exhausted and drained. We need to build up the adrenals. And then we also have to make sure that the liver is working properly, right? So this is how we start to understand that, okay, here are some of the systems that are involved. Let's try for like the main system to give a therapeutic dose and then start to build out some of the other supporting drops in order to help support that and see how we do. But this is an amazing program that I use for especially for kids and adults that have had allergies for like years, like stuff like my daughter, for example. I mean, literally, we've been able to take her off of all medications using this program right here, right? Her eyes would completely swell shut. And we're going to get to it still. Remember, these could also be used topically, right? And we're going to get into that, right? ALT is one of my favorite ones to use topically for allergies because you can literally take some, those cotton swabs or those things for makeup that you take makeup off with. They're cotton, kind of these cotton pads, and you take some water and you put the water into a glass, probably about that much, right? And then you melt the drops in there, and then you take and put some on the cotton and you put it on your eyes like a compress. And literally within minutes, her eyes will start to open, right? So again, this just continues to show you the versatility of how amazing this product is. Let's continue. Okay, so here is another example. This is a comprehensive program for immune function. Now remember, we can just use grow, right? That will work for immune support, right? And I always recommend my patients, especially during any kind of flu or, right, these days, who knows what's going on? We have disease after disease and whatever. So it's always a good idea to keep our immune system strong. So we want to take, a prophylactic dose of grow. And my kids who go to daycare and school, they're always taking something prophylactically for their immune system because this is really the kind of time we're living in, right? But then when you add in ALT and you add in air, by the way, air on its own also great for immune support. If you get any kind of colds or flus or bronchitis or anything, this is an amazing product just as a standalone product, right? Then add in MLS, right? And then we're hitting any of the microbes, viruses, bacteria, parasites, whatever it is in there that now is addressing that component. And ALT is opening up the lymphatic. So you see how we have now a comprehensive program that is now supporting the system and not just going after one symptom. And in this way, we see a much better result. For example, when somebody's really sick, I just had one of my patients. She was like, should I take antibiotics? Should I not? I really don't want to take antibiotics. I said, okay, let's start with this. You're going to alternate every hour. You're going to alternate one grow and one ALT, just one, right? But when it amounts to, you're going to amount to probably at least 3 or 4 a day of these, right? Then what I told her is at nighttime, take MLS, and air is to be taken if you have specific symptoms. Maybe go down on ALT or grow and alternate the next day. Instead of going grow and ALT every hour, go grow and air every hour, right? So there's no specific way. We just have to see what works better. And for her, it turned out that grow and air worked better than grow and ALT. So this is how we start to approach things. We just kind of have to see how our system responds. Let's keep going. comprehensive program for pain. And remember what I said, can also be used topically, right? So these two, my mother-in-law literally lives on these, right? I can't begin to tell you how many of my patients that have back pain, that have disc pain, herniated discs, that have, sciatica, that have all gone off of their medication just using these two. But I find that when you add this one in, it's like a whole other level of things start to happen. Let's just kind of focus on relax a little bit, because relax is that boost to your batteries. If your batteries are drained, doesn't matter what it is. If you had some kind of a sickness, you need to take relax. Based on the stress we're in, we should all be taking just a little prophylactic relax, right? So I always start programs with this, because that way it gives the body the capacity to do what it needs to do. If it has no energy, you're going to get more reactions. You're going to get more symptoms that you normally wouldn't. Like when I took these products, for example, if I went over, even when I was really sick, if I didn't do this, then my system would respond in a way that was not too favorable for me. So that's why I always recommend with comprehensive programs, it's a really good idea, especially if if you're really run down, start with relax and then add in other things. And, sometimes just a couple a day will be enough. But if you're really drained, you might want to do like a week or two. For example, you want to do like maybe 4 a day, right? Again, depending on how you are, if you're falling asleep in your job, obviously take it down a notch. But I always tell people 1 to 2 weeks, do the relax, and then start whatever program you're going to start, right? So again, my mother-in-law stays on this all the time. Again, stop and slide, we do them topically, right? So this is a really, really great combination for any kind of falls, any kind of bruises. If you have, anything with twisted knees, accidents, anything, these are great to do topically. I can tell you, and I've talked about this story before in Cancun. A year ago, I was on the beach and my friends came. I haven't seen them for a few years. I got really excited and I started to run towards them. And my little toe got caught on a suntanning bed and it went one way and I went the other way. And I was like, oh crap. And it was like first day on vacation. And I was like, okay. And this was again, I wasn't really used to doing them topically, but I kind of experimented here and there. I'm like, let's just try it. And I'm telling you, within 4 or 5 hours, from blue to black, it started turning to normal color. If I had an X-ray, I'm sure it would be at least partially fractured. But it allowed me to put my foot in, and within 3 or 4 days, I was able to enjoy my vacation a day. So I never leave home without these. Like I always travel, I make sure I have certain combinations of drops with me all the time, even when I'm traveling. Okay, so here is the combinations of topical applications. These are pretty much the main ones that are used for topical use. I'm not saying there's no use for other ones, but I haven't really found using, like, for example, brain topically to make you smarter. I'm just joking, but really, like, I just haven't found the uses yet. I mean, I'll experiment, and if I find something, I'll be sure to tell you guys about it, right? So we divide things into two groups, right? We already talked about here are the bottom ones. This is more for the musculoskeletal stuff, right? This is all for the falls, the bruises, the broken bones, the sprains, the strains, and all of that stuff. These top ones right here, these are more for skin conditions, right? These are good for eye conditions, right? Beauty is amazing for anything to do with skin. Like my little one, she scratched herself with a toy, and it was one of those things that would for sure leave a scar. And we right away put beauty on it. Again, like I told you, dip it into the glass, and we started to apply some compresses. And literally within 3 days, you kind of started to see how amazing it started to heal. Then for any kind of skin infections or eye infections, we can use Grow, ALT, and MLS. Remember, ALT, MLS is antiviral, antibacterial, and all the things. ALT as well, it's great for lymphatic drainage. So you can use different combinations. So these top ones right here are more for skin and eyes, and these bottom ones here are good for the musculoskeletal stuff, right? So again, remember, all you need is a little bit of water, and you just drop it in the water. Here's a little caveat. If you are going to obviously not use it at once, don't throw out that solution. It's good for 3 days in the fridge. And if you left in the counter, then it's good for about 24 hours. Then you're going to have to get rid of it. It's not that you're going to get sick with it. It's just that it's not going to do the job that it's supposed to do. Okay. So don't waste it because you can use it over and over again. And remember also, live and learn. Don't take the actual cotton and put it into the solution. Take the solution, put it, otherwise you'll contaminate it, right? So just make sure you put the solution on the cotton. Okay. Let's keep going. Okay. So cholesterol, blood sugar. This is what this slide is about, right? So remember, heart on its own can be used for decreasing blood pressure, helping with the cardiovascular system. But in a lot of cases, there's more things going on than that. For example, if somebody has blood clotting, you want to use heart and stop. Why? Because stop thins out blood. This is the only one that has a contraindication if you're on any blood thinners, right? Like Coumadin, for example, right? So these two are great for decreasing blood pressure. Also great, let's say post-COVID, right? We all know that COVID does all kinds of fun things in our body, right? And nobody wants blood clots, right? And so you can take these two. By the way, here is something interesting. I was flying to Dubai. I mean, that flight was, I don't know, I've never flown that many hours in a direct flight. And I was like, oh my gosh, why is my gastroc was hurting, like, the back of the leg. And I'm noticing like it was towards the end of the flight on the way back, didn't happen on the way there. It was like literally like, it felt like my skin was too tight around my gut. And I'm like, crap, that's not good. I'm like, and what I did, I got a little concerned, I'll be honest with you. So I had heart and stop. I took it literally within a couple of hours. You could see how the swelling just started to go down. My skin started to feel normal. So these two are great. Again, these are emergency ones, need to have kind of things. Then, of course, if you're going for decreasing cholesterol, heart and norm, right? Blood sugar. Remember, cholesterol does not go up because you eat fat. I mean, we're not talking about, crappy fat like chips and stuff like that, the trans fat. We're talking about, healthy fats. Cholesterol goes up, especially bad cholesterol, goes up because we eat too many processed carbs, right? And so norm decreases blood sugar. I wish I could give you all the amazing stories because I have each one for each product. I just don't have the time right now. But norm is great for decreasing blood sugar, but when paired with heart, it's great for decreasing cholesterol, right? And then remember, blood pressure goes up. Why? For stress. So we're going to include some relax in that too. And we know that obviously the liver is one of the main areas where cholesterol gets made and processed. So we want to support that as well. So here's how we built out a nice complex program, right? Each one of these could be used separately, but when used together, give you a whole different level of results. All right, let's go on to all of our emotional well-being and mental good stuff, okay? I love these two. At first, when I got this, I wasn't too sure about it because my patients started using it and they're like, I took it, but I don't feel happy. I was like, and then I took it and I wasn't like, I don't necessarily, but it has a very distinct feel to it. It's kind of a relaxed, focused kind of attention, just kind of takes you down into this kind of space where it just feels like everything is okay, right? Not necessarily like, oh my God, I'm so happy. And, we're not comparing this to alcohol or other substances, right? So we want to make just sure that we are understanding how these things work. All right, so relax and happy are my two go-tos for any kind of stress. And this is also really good for menstrual cramps. I also gave this to some people that had this, just doing this and this, they've gotten off their antidepressants. Now, here's my disclaimer. Please do not come off of any medication right now based on what I'm telling you. If you are on any medication, please go to your doctor and make sure that they take you or change your dosages for the medication, okay? So again, here is another great combination. This is for people that, have no energy, especially long COVID. This is a really good combination for when people are just post any kind of infection, right? They just need that energy back. They need the focus back. This is a really good combination, the relax, the brain, the happy, and the GTS, right? Remember, GTS on its own just gives you energy. I had so many long COVID patients that just by taking GTS, they were able to, or not being able to do anything, they were able to start walking and getting back into their routine. So sorry, I'm taking a little longer. I'm trying to go as quickly as possible. This is a great combination for kids with attention deficit disorder, learning and behavioral issues, right? Where you see here's grow. You're like, why grow? Well, grow as its own thing is very replenishing, right? And these kids are usually very devoid of things. They don't usually have a good diet, right? And they don't want to eat anything. This is the other thing why I love about this product. Most of my kids will now take the products, and I don't have to figure out how do I dosage this. They don't want to take the pills. So this is so versatile, and I love how the kids respond to it, because they respond quick to it, right? And they'll ask for it. They're like, can I have that candy? And I had one, he's like, Mommy, I feel so stressed. Can you give me that candy that makes me feel happy? And so it's just amazing to see how they feel how these products work. Okay, detox program. This is something that everybody should know about. If you have a chronic issue, and it's not responding, you should probably do a detox program first. And this is the combination. You want to do that for 3 months. Really take all the things out of your body that your system has built up. And then your body will be able to start doing what it needs to do with the program that is actually designed for the symptoms that you're trying to clear. Okay. So again, relax, ALT, ICE, HPR, and MLS. If you notice, there's really a lot of similar combinations because a lot of the similar systems are involved. Okay, look, just to my point, right? Comprehensive weight loss, detoxification, right? Most of us want to use PFT, right? And it's an amazing product, works great on its own. But for those people that are looking more of a long-term kind of thing, like I'm going into my wedding next week, can you help me with my weight loss, right? So here's some PFT. This is more for the long-term approach. This is kind of doing the detox part first, normalizing blood sugar, normalizing your stress levels, and then doing the weight loss, right? Because that will work much better and you'll get a much better longer-term effect. Okay, so be patient because even miracles take a little bit of time, right? So I hope that gives you guys a little bit of guidance. I know there's a lot of information to unpack in there. I was only given 20 minutes. I know I went over time, but on that, I am complete. So that's my presentation.
And I'm looking forward to being able to explain why I'm using the wonderful DNA healing lozenges in my health practice. And we're at about a year and a few months now that I've been integrating that into the practice. So I've been hearing stories from my clients of symptom relief. And symptoms are basically what you experience on a more of a surface level, rather than what's really causing the underlying reasons for that. But it's still really wonderful to hear, as well as confirm that the health challenges are improving while they enjoy the power of the lozenges, and the flavors, of course, are always tempting too. I wanted to be able to quantify the benefits of the DNA lozenges and witness the shifts in the body maps that are accessible and recognized in the blood of these clients. I work with this specific form of data gathering for about a week out of every month, and clients just come in back to back for this experience during that week. The body is brilliant. There are many roadmaps that can be read based on the type of practitioner who's doing the readings. One such example is the blood. And I've sent over to Carmen 3 client studies that I've been doing at the beginning of when they come in to look at their blood, about midway through the process, and now where they're at in their progress. So this is client A. I have 3 different slides here, and I'm just going to have you look at these while I talk a little bit more about how we integrate this by virtue of the feedback that the blood gives us. So I've talked before about the great benefits of direct blood and cell nutrition, which is how these lozenges perform. We can bypass the digestive process and deliver via the sublingual processes, and we have a fantastic method of supporting the whole health of the individual this way. In this work with the blood, which we just take 1 little drop of blood and we put it under magnification, it's really, really obvious that there's congestion in the digestive system of nearly every person. And that's a combination of inflammation, toxicity, poorly digested foods. So as you're looking at this initial slide here, this is my 44-year-old client. This was his first dry blood or living blood sample. So you can see all of these little cells. These are actually red blood cells that are lying in the plasma of the blood. And there was very little movement, if any, and that's one sign that we've got dehydration, inflammation, all kinds of things going on that prevent the plasma from moving the cells around. The other aspect of this is that the cells are aggregating and lining up in chains that we call rouleaux. And that's an indicator right there of poor digestion. It's an indicator of the acidity and toxicity of the bloodstream. It's an indication of dehydration. So basically, as we're looking at these first samples when people come in, we can see pretty clearly what needs to be done. So in this case, we would want to find some way to separate the blood cells. That's done through improving digestion, increasing hydration, getting the client more interested in doing some movement throughout the day, which would be a fabulous way for all of us to consider doing that. And that's pretty much the basic aspect of slide number 1 here. So when we started working with him, we were teaching him about what it means to have complete digestion, which means that we're not going to leave a lot of garbage in the bloodstream. We're not going to have a lot of stuff sitting in the gut that doesn't go anywhere. And then that creates a lot of acidity and toxicity, which spreads throughout the body. So as we're starting with this process, we're going to give them directions on what types of foods to use together for more complete digestion. We're going to use a proper method of hydration, which speeds that process along. We teach them about the foods they're eating, the toxic and inflammatory foods that often bear no actual resemblance to real food. And then we talk to them about the purpose of eating, which is to live rather than living to eat. So as this process continues and the clients implement these foundational supports, then we're able to witness a more expeditious improvement by introducing the lozenges. So when we're dealing with digestive healing, other than those things which I already mentioned as lifestyle changes, we will implement MLS, ICE, HPR, those types of things to help stimulate and improve the utilization of food. We also are going to want to clean up the detoxification pathways, which are the liver, the kidney, and the lymph. So Dr. Granat was talking about the detoxification benefits by opening those pathways. So I have an image in my office of 2 fish. One is in a dirty tank and one is in a clean tank. And the caption under the dirty tank is the medical approach, which says medicate the fish. And under the clean tank, it says clean the tank. So it's a real obvious contrast between treating symptoms and cleaning the detoxification pathways. So for that, I use HPR for the liver, gallbladder, and pancreas. I use Power Lemon to support the kidney function and ALT to support the lymphatics. And I also teach the clients to do some specific movements and activities to get their lymphatics activated. So the liver, kidney, and lymph obviously are the body's filtration pathways. And I also include stop and slide for the inflammation and pain, which are manifesting due to the dysfunctions in the detoxification pathways. And Dr. Gannett covered those beautifully, the benefits of stop and slide. So we also look at, and I didn't send over an image of this, but imagine a red circle of your blood that has sat on the slide and is coagulating a little bit. And it starts to develop its own images that tell us about congestion in the lymphatics, for instance, or poor hydration, or we can even see heavy metal issues. We can see mineral needs. We can see inflammation and congestion, which creates just a lot of messy, red, puffy images in the cell itself, the cell's red blood sample, dry blood sample. So this kind of helps us corroborate between the moving and the dry blood so that we can see where the biggest issues are. And it's also well known that inflammation is a huge boogeyman in almost all health conditions, and an inflamed body is not able to detoxify effectively either. So Dr. Granat also pointed out that stress is a factor in everybody's lives, and we can see that in both the moving and the dry blood. And stress itself usually is not the cause of these health impediments, but it surely aggravates all of the underlying influences. And so we look for signs of stress to be able to ascertain how much stress is a factor in each individual's health. So let's go to could you move to client B, the first image? Okay, so that big ball on the side there is actually an air bubble, so that's not in the slide. It's not in the blood. But this is a good image to show what stress can do in the body and how it manifests in the bloodstream. So these red blood cells will show us medial to dramatic signs of stress. And the red blood cells will form themselves into a C shape or into a circle or donut shape when the body is producing too much cortisol. And it's one of the adrenal hormones that creates inflammation, aggravates sleep, can contribute to weight gain, inability to manage daily life stresses, brain fog, and it pretty much aggravates every other condition. We also see its influence in dry blood samples. So managing stress is something we all need, and of course using RLX for this purpose is super powerful. It's one of the most fast-acting lozenges in our arsenal. It helps with the daily compression of stress levels, supports the adrenals, and is very, very helpful to improve sleep. So if you'll go back to the second slide of client A. Okay, so we're still seeing some congestion in this sample. We didn't see quite as much movement as we would like to see, but the dramatic improvement between slide 1 and slide 2 is evident to anybody who doesn't even know what we're looking at. So that shows all the congestion, aggregation, and this shows the red blood cells mostly lying on their backs, mostly not congesting with other cells, and able to use the full cell membrane in order to detoxify, to supply oxygen to the red blood cells, and to support nutritional benefits. So in this slide, you can also see a little bit of differential between the sizes of the red blood cells. So if we have some red ones that are really large, or some that are really small in comparison to what the norm would be, we know there are some specific B vitamin deficiencies here. Let's see if I can see, go to client C, the first image. Okay, this is the first time that we have seen this lady, and we just about dropped our teeth when her blood looked like this, and it completely was evidence of why she feels so terrible. And some of these red blood cells have kind of a bottle-shaped area around the edge. I mean, a bottle cap shape. So think about, popping the top of a beer and what that bottle cap looks like. We saw an awful lot of that in this. And we also saw some cells that just like they had little pokies on every portion of the cell. And those are both telling us about oxidation or aging processes. So if you think about what happens to maybe your car bumper when it begins to rust, that's what we're seeing when there's free radical damage, that it needs to be dealt with antioxidants. And so many of the lozenges have antioxidant properties. Also, that there's a possibility of some of those super pokey cells being at the end of their life cycle, which is about 120 days. So there's a lot of blood cells coming in and a lot of blood cells going out on a continual basis. Let's go to the next slide for client C. Okay, so you can see the improvement that we've gotten here. And you can also see some evidence of a real shiny over in, I hope it's your right, it's my right, over in the right portion of that sample. And that is actually uric acid that is accumulating in the blood. And uric acid is a metabolic process, but it tells us that the kidneys are under functioning. It also tells us that there's probably still some dehydration. If you'll now have somebody asking if we see images or evidence of people that were vaccinated. And if you go back to the first slide of client C, you'll see that big, long, greenish thing there. We've determined that that is relative to the vaccine. So we're calling it right there, we're calling it a hydrogel. Some other people give it a different name, but that's evidence of stuff floating in the plasma of the blood that does not belong there. So yes, that's partially what we see in people that have been either jabbed or that have been shed on by family members or people at work. So this also, if you look at the next slide on client C, we can still see a little bit of cloudy stuff going on in the plasma. And a lot of times that represents blood sugar aggregations. And it's a manifestation of incomplete digestion and blood sugar that's probably out of balance. So when we see these things in the blood that don't belong in the blood, then we know that there are manifestations in the body, such as illness relative to blood sugar. It can be, hypo. It can also be a food source for microbes that enter up into the bloodstream because of a leaky gut situation. And there's just food sitting in this plasma for all these microbes to just go develop a whole new style of life. And so we want to make sure that the bloodstream is free of this kind of cloudy, speckled appearance, and that we're implementing the food combinations and the right lozenges to help them more completely digest. Let's go back to client A, the third slide. Okay, so we saw this gentleman last week. This is probably about a year into his live blood journey, and hopefully you can remember what it looked like in slide 1 right there. Compare that to slide 3. Look at how amazing that looks. We've got movement. The movement didn't stop for almost 30 minutes on the slide, which is amazing. We didn't see any liver markers in the live blood. We didn't see any garbage floating into the bloodstream. And if you look at the halo around those cells, that halo is produced by a negative ion charge. Where have we heard that before? So the negative ion charge obviously is powerful, and the benefit of utilizing the lozenges with that negative ion charge cannot be overly stressed. The thing the negative ion charge does between red blood cells is it repels them away from each other so that they can do their job more completely. When we have a lack of that, we have a pH balance problem that causes the blood to be acidic, and they attract each other. And when they're attracting each other, they're not using the full cell membrane, and they're not able to completely detoxify, oxygenate, or nourish the cells. So that's where he is right now. Let's go to client B. This was her actual, the first slide for client B. This was actually her first time with live blood. She's been exceptionally health conscious for many, many years. And so for this to be the first image of her live blood is very powerful. And it's a testament to really taking care of yourself, putting your health first. She did have an issue with repeating virus syndrome, and that was one of the main reasons that brought her in. So she was on HPR, MLS, and AIR. And when we saw her again, the next slide, please. This is what the next slide looked like. And this was about, I'm not sure if this was her second or her third return visit. We do them at every 8-week intervals, but she had not had a repetition of that virus problem since the day she started that combination. And she still to this day does not have any of that going on. And she has been utilizing these lozenges since October before last. So she's been free and clear of this viral syndrome since then. The next slide, please. This is her last week. It's so great that she and the initial client came in, client A came in the same week, because we were really able to grab these slides and just show the amazing benefit of working with whole food nutrition, full digestion, implementation of the detoxification pathways, and I have seen exponential improvement since we've introduced the lozenges. So let's go back to client C. This lady was manifesting inflammation in every aspect of her life. She wasn't sleeping. She couldn't think straight. She was exhausted. She had, sorry about that. She was just exhausted all the time, was dragging through work. And so the main things that we focused on right at the beginning was helping her combine her foods better, hydrating, helping manage her stress. And of course, that included RLX. We implemented better digestive support with the MLS, HPR, and ICE. And let's go to the next slide. So this was about 6 months into her process. And you can see, this is one we've already referred to, you can see how much more energized her blood is. We still have a little bit of crud in the blood plasma and that uric acid crystal. We still have some aggregation in the red blood cells, but we had no evidence of any of those weird things that we see after the jabs. Her energy was improving. Her skin looked amazing because her internal organs were doing their jobs much better. Sleeping better, much less body pain, less brain fog, and you can just see the difference, why she would be experiencing these things at this point versus what she was experiencing in the first slide. Let's go to the third slide, please. Okay, this is a close-up image. She didn't come in this month. She came in last month. So this is a little bit more close view of the red blood cells. You can see that they're more separated. You can see that they have begun to develop that beautiful negative ion halo. There's much less crud in the blood. The movement was amazing. And she felt like a new person. She'd lost about 30 pounds by getting rid of all the lymphatic fluid that was accumulating and the inflammation. And she has started a new job, which she just shared with me. She is raising exotic birds from the egg up. And she showed me some pictures of these cute little eggs and cute little birds, and she's just loving her life now, and she's able to just live the life she loves because she feels like a human again. So I hope those things were helpful in determining what the maps of our blood can show us. We have, I do other ways to access information from the body via these various body maps, but those, a lot of times people have to take my word for it, and they don't have to take my word for it here. So I didn't see a lot of evidence of white blood cells in there, but they are also evident in the plasma. They are larger than the red blood cells. They have a shorter shelf life, but they demonstrate the immune system of the blood. And there's 5 different kinds of white blood cells. Each of them has a different job to manage the immune system. So if we see way too many of those, we have an overly activated immune system. When we see too few, we have an underactivated immune system. And so we utilize the GROW and the HPR MLS. So Kevin is asking how much time between slide 2 and slide 3 for this last client. I believe that was probably 2 visits, so it had been about 16 weeks. And this is just based on my recollection, but of course, I chose the best ones that have been on these programs the longest, that show the most dramatic results. And I just hope you guys understand that our blood will demonstrate whether we're healthy or not healthy. Also wanted to tell you that when we do these live blood processes, in order to have the living blood analyzed, I have to have the people in my office. But if people outside the Vegas area or people who don't want to come into the Las Vegas area want to have their blood analyzed, we can do it through a dry blood sampling kit that we send out to people and teach them how to sample their own blood and send it back in for analysis. So that's a big part of what we're doing too, so that we can reach people more remotely. So hope you obtain some understanding. I really believe more health professionals should introduce this into their protocol. And I think they would, as Dr. Granat has shown as well, exponentially improve their health.